We're just frightened as hell because we don't know what's happening. My child could die from this.
Ira's adult child caught COVID-19 shortly after being admitted to Nepean Hospital's mental health ward.
The struggle that my child is having mentally is now actually deteriorated because of having contracted COVID within the ward.
Out of 28 patients on the ward where Ira's child is staying, 26 have caught the virus. 2 are in ICU. Whistleblowers from other Western Sydney hospitals are going public with their concerns for themselves and those they care for.
We are really terrified for the safety of our patients.
I feel let down by the people who have the power to make a decision.
The outbreak at Nepean's mental health unit is the biggest faced by the state's public health system.
For my child to be exposed to COVID and contracting the illness and already being in a fragile physical and mental state of mind is very concerning.
Another patient tested positive on August 4. 2 days later, Ira's child was admitted and tested positive within days. 3 staff members told 7:30 they found out when a colleague alerted them on a social media group chat. By the time staff were officially told of the outbreak, 6 patients had already contracted the virus.
Our child was saying, we're all mingling, we're all, doing our own thing and talking to each other, passing each other.
When Ira's family called the hospital to express their concern, they claim a hospital official predicted the entire mental health ward would become infected.
How is that okay for a senior member of the health team to make the assumption that, everyone's going to get it anyway, we'll let them mingle? It is not okay.
2 nurses who work at the unit have sent statements to 7:30 confirming Ira's account. They also claimed infected patients weren't being isolated from uninfected patients and there was no plan to separate them. A 3rd nurse contacted the New South Wales Health Minister claiming the spread of COVID in the ward could have been prevented and urged him to investigate. After receiving questions from 7:30, the Minister has now responded to the nurse seeking a discussion about their concerns.
My husband and I, we were angry. We were, frightened for our child who already has a compromised immune system plus mental illness to be exposed to this in such a, in a way where it's almost like people with mental health don't matter.
In a statement, New South Wales Health said when COVID was first detected in the unit, infection control measures were introduced, but the first patient who tested positive had been interacting with others while infectious.
When you hear about acute wards, acute settings in mental health, having COVID patients facing these challenges, one's got to say, what more was planned?
Professor Ian Hiki is a former National Mental Health Commissioner. He says mentally ill patients are distinctly vulnerable to COVID-19.
We know people with pre-existing mental illness, particularly psychotic disorders or major mood disorders like depression and bipolar disorder, actually get sicker, are more likely to hospitalise and are at greater risk of death.
Professor Hiki is calling for more resources to help public hospitals deal with the pandemic.
We should immediately have recruited the capacity in the private sector to take pressure off emergency departments and to give us the full range of services that are available.
Those pressures are a symptom of a public health system under stress as it treats more than 800 COVID cases in New South Wales alone. As of Wednesday, almost 80% of the state's intensive care beds have been full. 24 patients have now died after acquiring COVID in hospital.
It's exhausting. Everybody is feeling it. I think staff, management, doctors, everyone.
7:30 can reveal that Cumberland Hospital's mental health unit is also grappling with an outbreak. It started with a patient who tested positive on Nick Housen's shift.
And there's not a lot of nurses to go around at the best of times, but in the early stages of the outbreak, to work 3 or 4 staff down at a time, it made it extremely hard to do our jobs.
There are now 12 cases in Nick's unit and 1 patient has died.
It's not an ideal environment for an airborne infection. Mental health units are set up very differently to a general hospital. They're more of a cross between a hospital and a long-term care facility. They don't have negative pressure, they don't have en-suites in one for our age. We've still got a lot of shared bathrooms and shared rooms where we are.
I'm very concerned for my safety and my colleagues' safety. I don't think any of us feel safe going to work at all.
Eliza Wright works at the mental health unit in Blacktown Hospital, where there are no cases.
We're just waiting on the day where one of them's positive, and at that point we don't know what's going to happen. There's no guidelines for this. We're just winging it. We're just doing our best with what we know.
Eliza says her team has also struggled with consistent access to PPE.
We raise it to our manager, they raise it to their manager and so on, and somewhere along the line they just say, oh, but there's enough. And you just say, well, no, there isn't.
In a statement, New South Wales Health said hospitals review their infection control procedures regularly based on expert advice. Professor Hiki says despite the concerns about COVID, no one who needs hospital care should hesitate to get help.
Anyone who needs acute mental health services, they too should expect to be treated with respect and with dignity, and there's maximum possible protection from acquiring COVID-19 as a consequence of attending our services.
Since Ira did an interview with 7:30, her adult child was sent home despite the family's wishes that hospital care continue. Within 24 hours, Ira's child was readmitted to Nepean due to mental distress.
There's not enough support in there. I think it comes back down to not having the right processes in place after 18 months of COVID.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.